Welcome to this second video on methodology on tips and guidance about writing thesis protocol. So there are certain aspects which need to be covered in the methodology as well. And sample size estimation is something that should be committed to in the protocol, or at least should be given certain due regard or reference. A formal sample size estimation can be done for many of the studies. Online calculators are available, and software like GPower is also available. Now, what is required while you do sample size estimation? You require previous literature, if available, relating to this topic to give you some kind of estimate of mean, standard deviation, or frequency percentage of a particular event in the population of interest. And you need to have certain assumption about the degree of uncertainty that you are going to tolerate. For example, you want your results to be too precise, then your sample size is going to be on a higher size. If you are willing to have a little bit of leeway on the kind of confidence you have on the results that you get, then a lower sample size should also be sufficient. Now, feasibility is also important consideration, and you may get a particular sample size, but you may defend taking a lower sample size, citing that in your setting, this is what the feasibility is because of so and so reason, and that might be a very acceptable way of having your sample size determined. Now, for example, this gives an example of what kind of statements go in writing a sample size estimation. So we have an instrument FAD for which scores are available from a different study. So we mention in the intervention and control groups what the scores have been, and we mention to get an effect size of so and so at a particular power, at a particular randomization, the sample size requirement for each group. So we need some data from a previous study, and we need some assumption. Some assumptions here are the effect size, the power, the randomization ratio, and then we are able to get the requisite sample size in each of the groups. Now, the methodology section should also mention something about the statistical analysis plan, how the data would be represented should be mentioned first in the form of descriptive statistics, generally in the form of mean, standard deviation, median, interquartile range, or frequencies percentages. Then how the primary objective will be dealt with, or what would be the statistical analysis for your primary objective should be mentioned. Other objective, how it will be analyzed should also be mentioned in the method section. More sophisticated tests, for example, linear regression, repeated measure test, etc., can be referred to or can be mentioned in the statistical analysis plan, but you should have some leeway. For example, if the assumption of linear regression are not met and you have committed linear regression, then there might be a little bit of an issue that you have committed this test but you have not done. Right? So you can mention that if the assumption of these tests are met, then you are going to do these tests. You can also mention about any subgroup analysis or sensitivity analysis. You should mention about how you're going to deal with missing values. Now, there are various methods of dealing with missing values, but what you are going to use in your particular study, you should be much more clearer about it and should preferably mention it front. And you should also mention about the significance level that you are going to use for inferring positive results from your inferential statistics. And generally, it is taken at a level of 0.05 or less. A p-value of less than 0.05 is generally considered as significant. Now, ethics are an important aspect, and adhering to ethical guidelines is of quite an importance. The study should be ethically acceptable. So what are the different aspects of ethics that you need to be cognizant of? It should be covering autonomy and informed consent. It should also be mentioning something about confidentiality of the information. The information taken from the patient should not be loosely or easily available to everyone concerned. It should also mention about the invasive procedures that are to be undertaken and the risks involved. For example, if it is a questionnaire-based study, the risks involved are less. If it is a study that involves spinal anesthesia, then the risks involved are more. So the fair assessment of risks should be there, and it should also enable the participant to withdraw from the study without any loss of benefits they are otherwise entitled to. So taking a part of the study should not give them undue advantage, and taking themselves out of the study or not partaking in a study should not give them any undue disadvantage. Now, it is a good idea to acknowledge what kind of biases are there in your study, because biases are likely in any study. So there is probably no study which has no biases. It's a good idea to be aware of what kind of biases are likely in your study and upfront acknowledge them. For example, there can be selection biases. If it is a hospital-based study, there can be observer bias, there can be recall bias, there can be sampling biases. For example, if it is a purposive sampling, there can be a lot of purposive sampling related biases. There can be Hawthorne effect, there can be design bias. For example, if it is a randomized controlled trial uh, or a clustered randomized trial, so there can be design issues. There can be classification biases, and there can be other biases. So there is a host of biases, but it is a good idea to know which biases are applicable in your study upfront. You should also be aware of the costs and resources that are being expended as a part of this research, the part of the researcher and the part of the patient. Better to be cognizant where the money is going to come from for investigations, for testing, for instruments if it is required, for reagents, etc. So who is going to bear these costs? Cost also in terms of the necessity to visit, make extra transportations on the part of the patient. So that also involves cost, and that may deter away participation or follow up. So be cognizant of what costs and resources are involved and who is going to pay. With this, I'd like to thank you for your patient listening, and I hope this video has been useful, and it will be enabling you to write a better thesis paper. Thank you very much.